Hello, Dr. Bob here on another podcast about optimal health. This podcast is going to deal with a very, very important topic, that of cancer. Cancer rates on many types of cancers throughout the world are growing, and the treatments for cancer in many ways are almost worse than the cancer themselves. Some forms of cancer take a long time to develop, but the treatments are generally radiation, chemotherapy, and in many ways, many of the surgeries are used to remove a tumor or a cancer. And so it just makes a lot of sense that the better way to approach this is to prevent cancer. Now, what's interesting is that most cancers are preventable, but you got to know how to do it. And in fact, we live in an environment, in a world where there are so many causes of cancer, so many things that are actually causing cancers in people. And if you knew what to do, you would indeed avoid them. And so we're going to go over that. I'm going to talk about the ways of avoiding cancer. There's about 10 different things that you really need to talk about. Also, if you have a genetic proclivity to develop cancer, whether many people in your family have lung cancer or gastrointestinal cancer or breast or prostate cancer or brain cancer, it certainly makes a lot of sense to take the precautions to really prevent cancer from actually initiating. And so what's important is to discuss the different ways to actually prevent cancer from developing. Again, as I said, if you're more susceptible and if you are in an environment that is very susceptible to forming cancers, it certainly makes a lot of sense to try to prevent the best you can. Our bodies are amazing tools to be able to help this. If you give it a chance and you give it a tool, we detoxify very well. Our immune system is meant to handle cancer cells that form all the time in our body. And but we need to provide the body with certain things and knowledge about how to avoid cancers. So providing it with certain tools and avoiding certain situations that dramatically increase cancers are very important. So we're going to go over those. And the first thing is that many, many cancers come from viruses, whether it's gastrointestinal, whether it's cervical, whether it's the breast cancers. So many different cancers are induced by viruses. And so to be able to know how to avoid these viruses, many times we don't know, but also to build your immune system is so, so important, and providing it the tools to be able to fight off the development of cancers. Another cause of cancer is electromagnetic frequencies. These are a type of pollution that we get from exposure to electromagnetic frequencies, like high tension wires. Our cell phones, especially if they're put up near the ear, are full of low frequency EMFs, electromagnetic frequencies, that lower the immune system in an area. And especially like cell phones, electric blankets, those kind of things will disturb our own electrical systems in our body and create more of a chance to get them. There's been studies to show that the problems with cell phones can cause problems, especially brain cancers with younger people who use cell phones next to their ears, next to their head all the time, can indeed increase the chance of brain cancers. One type of cancer that is, or should we say, one type of irritant way to avoid cancer, we now know, it's been true that we've known this since the 1960s, is that smoking or exposure to environmental smokes and excess alcohol are things that do increase the chance of cancer. Lung cancer is certainly much higher in people who are smokers or even involved with or exposed to secondhand smoke. So very important. I personally have not consumed alcohol for about 20 years now, simply because I knew that was an irritant. But the guidelines are that maybe 1 or 2 alcoholic beverages a day are pretty non-irritating. But if you truly have a concern about developing cancers, especially gastrointestinal cancers, esophageal cancers, oral cancers, those are, you would be wise to try to avoid any alcohol or any toxins along those lines. Another form or association of cancer is the lack of physical activity. Now, what's important here is to keep your metabolism going with physical activity. The research has shown that lack of physical activity increases the chance of cancer probably around 45%. And so it's very important to do that. And physical activity also decreases the chance of getting cardiovascular disease. So it behooves all of us to do some physical activity. A very important part of our immune system is the lymphatic system, the second circulatory system. That is something that brings immune cells to an area of irritation. And if you are not getting proper circulation of the lymphatics, you're not getting good detoxification, and you're not getting a strong immune system. So very important there. Obviously, poor diets are a big cause of cancers and other illnesses, but cancers especially. Now, what is a poor diet? Poor diet is one where there are low nutrients. You have processed foods that have taken the nutrients out. Sugars are processed foods. There's about 60 names for sugars you can read on the labels. Foods that have all kinds of pesticides in them. So organic foods are really the way to go. But it's best to have a very high amount of natural foods that come in the grocery stores without labels on them. It's best to shop in a grocery store in the peripheral of the grocery store. The middle aisles have all the processed foods in them. So things without labels on them are really the way to go if you want to prevent cancers and to really provide good nutrition in your body. As we get older too, it's important to take digestive enzymes to be able to digest, because we lose our ability to digest and get a proper amount of nutrients into the bloodstream and to the rest of the body. Obesity. We are increasingly in a society where obesity is very, very common. In fact, it's estimated that as many as 70% of the population is overweight. And when you see even young kids who are overweight, this is tragic because obesity greatly increases the not only cardiovascular disease, but it also lowers our immune system and it increases the chance of getting cancer, especially if you have abdominal obesity. This jeopardizes the organs and tissues all around the upper body of getting cancer. So diets are very, very important in terms of prevention of cancer, not only getting nutrients, but avoiding processed foods and also avoiding the contaminants like pesticides and so forth that are in non-organic foods. So very important along those lines, and to choose the right things. You want to choose the healthy foods, the fruits, vegetables, legumes. You want to get the meats and the fishes in your diet that do not have the pesticides or preservatives in them. So diet and nutrition is very important. Another very common, and as a retired dentist, I know this, dental infections lower the immune system, but they can also be a very big source of cancers, root canals that are infected. And the best way to do this is to get a x-rays and or scans of root canal teeth because they can be hidden and not be symptomatic. So it's important to think about that. Root canals can be a great source of infections. The other problems are heavy metals in many of the restorations, nickel in replacement of teeth are all sources of infections that should be avoided. I recommend highly that you see a biologic dentist if you have root canals, if you have the mercury dark fillings in your mouth. Fluoride can also be a source of cancer, even though it's intended to prevent decay in the mouth. It really is a source of cancers and or chronic illness. So I would suggest strongly to avoid fluoride treatments and get toothpaste that do not have fluoride in them. So dental infections are also, that includes gum infections, are also a cause of, a potential cause of cancer. Ionizing radiation, CAT scans, that kind of thing can be a source of cancer. Here's what happens when you have these overexposure to ionizing radiation. What happens is they disrupt not only the DNA in your cells, which can eventually become a cancer, but they also kick out electrons, which are kind of the basic fuel that the body needs to have immunity, have recovery, and so very important to try to very much avoid ionizing radiation, such as CAT scans. Now, if you have to get a CAT scan, one thing to do is take melatonin prior to and after the CAT scan. This will help prevent potential damage to the tissues and maybe even eventual radiation damage that can cause cancer. Melatonin is very, very good. Melatonin is something that the people know as far as helping you get to sleep. But in fact, we know that melatonin is one of the great brain protectors of brain cancers. And brain cancers are very, very difficult to treat, whether it's radiation or chemotherapy or surgery. is really jeopardizing some very important areas of the brain. Environmental pollutants. They are significant in certain areas where there's a lot of manufacturing, where there's a lot of high tension wires. Those are the ionizing radiation, but also to live very close to where there's ionizing radiation can be very damaging. So when it comes to environmental pollutants, the farther away you can be from not only the ionizing radiation, but from pollutants, factories and stuff like that, the better you are away from that. What's interesting is, and this is very important, I heard this on the news today, that the people who were around 9/11 and were helping rescue people, were helping clean up the pollution there, they were exposed to a lot of environmental pollutants, and many of them have died. In fact, one person that was a very prominent person exposed, I heard just today, died because of the pollutants they were exposed to during 9/11. So be very careful in what you're exposing yourself to as far as environmental pollutants. One of the environmental pollutants that people are not aware of, but are very, very prominent, and that is that of mold exposure. Whether it's mold spores, more mold toxicity, it's estimated that as much as 1/3 of the houses in the US have some mold damage. So if you've had flooding, if you're in an area where you've had water damage in the house, you know you're going to have mold that's growing there. This is very prominent in areas around which hurricanes hit very frequently, Louisiana, the Florida coast, that kind of thing. And so if you've had water damage, you are necessarily increasing your chances of mold exposure and cancer. So very, very important as far as that. Also, chemicals and exhaust. So places where you expose to a lot of diesel exhaust can be sources of toxicity and thus can be a cause of cancer. Another thing is talking about environmental pollutants is that what they put on lawns, whether it's on the golf courses or whatever, all the chemicals. Women professional golfers have higher rates of breast cancer, and men professional golfers have higher rates of prostate cancer because of the exposure to all the chemicals. Just heard a story the other day that a person's home, actually their condo, the lawns were sprayed with glyphosate or Roundup, a very damaging toxin, and their little dog, which was 6 months old, walking around on the grass that was sprayed, had a seizure. And this was directly a cause of the pollutants that are put on grass, put on the lawns. And so very important to avoid that. And especially when you're gardening, avoid the glyphosate, the Roundup that is used as pesticide, herbicide, that kind of thing. Also, home chemicals. Home chemicals are very polluting if they aren't natural. Like you can use some of the natural things, apple cider vinegar, those kind of things to clean the house. But if you're always cleaning with chemicals, you can be very susceptible to cancers, lung cancer, skin cancers, those kinds of things. Cleaning women who deal with cleaning products also have much higher rates of breast cancer, lung cancer, those kind of things, because they're dealing with that all the time and they're breathing it in and exposing their bodies to it. So understand environmental pollutants are so critical in exposing you to chemicals that change our cells, change our DNA, cause cancers. Now, I've kind of left the biggest source of cancers, and that is the exposure to ongoing stress. Stress can be internal, it can be external. If you're in chronic pain, you're going to have ongoing stress. If you're in financial difficulty, if you have relationship stress, if you have any numbers of stress in your workplace, people who you are with, you are going to lower your immune system and you are going to be more susceptible to cancer. So when you're in these situations, you really have got to minimize them. For example, if you have in a stressful relationship, get out of the stressful relationship. If you are in a stressful job and it's ongoing, get out of that job. The other ways are to be able to do things, do activities in your life that counter the negative impact of stress. And that those are things like exercising, like meditation, like praying, many things. Yoga are good ways to reduce the stress in your life or to counter stress that is very hard to eliminate. But stress is very important to minimize. The hormone that results from stress, and stress causes the adrenal glands to produce cortisol, which is the stress hormone. Now, cortisol is good to help us deal with low stress, short-term stress, but it's very damaging to our body. If you have these things in your life, it's very, very important to be able to lower your stress levels and do things that decrease stress. What I tell my patients is make a list of things that you really enjoy doing. Is it reading? Is it going to the movie? Is it yoga? Is it exercise? Whatever, going on trips, playing with a pet. All those things are very good. And you should put a little bit of each one of those, or at least one of those, every day into your life, whether it's 10 minutes or 15 minutes or an hour or 2 hours, to decrease the stress in your life. One thing that's important in decreasing stress is getting a good night's sleep. Sleep is important because it helps us recover from the day before's activities, the damage that the day before is doing to us. And if you are if you're sleeping in a bedroom that's not dark, is too hot or too cold, has electromagnetic frequencies, and I urge you to move the phones away from the bed. Keep your head away from electrical circuits. These are all very important to be able to get a good night sleep and to recover. Now, I always ask people that if they can't get to sleep, is they've got to have better vagus nerve to relax them to get to sleep and to be able to eliminate blue light in your life, and to also be able to tone down an hour or 2 hours before you go to bed. If you are waking up, you're suffering from low blood sugar that the brain stimulates to be able to raise the blood sugar and allows you to get to sleep and stay asleep. If you're having trouble staying asleep or getting to sleep, take a little bit of a protein powder in some water before you go to bed, and this will keep your blood sugar normal throughout. Now, another strategy is something called grounding or earthing. What grounding or earthing does is when you're exposed, you can walk around on bare feet on the earth, or you can have earthing devices in your bed, or you can really be exposed to the earth environment where there's a huge amount of electrons. Ionizing radiation, toxins, stress, all remove our electrons. We need to add electrons. One of the reasons why it's very people like to go to the shore is because the running water emits a lot of electrons. And so very important to get electron exposure. And one way to do that is vitamin C, sodium bicarbonate, vitamin C, and glutathione, and molecular hydrogen are all very good sources of electrons to be able to counter the damage that certain things, pollutants, electromagnetic frequencies cause to our chemistry, cause to our cells in our body. And so you need to replace the electrons. And this is what we call, and I've talked about this before, is it quenches free radicals, which cause damage that results in cancer. So very important to look at the things that cause cancer. You want to avoid ionizing radiation. You want to eat good diets. You want to eliminate smoking or exposure to smoke. Minimize alcohol consumption. You want to decrease your stress, eat good diets, avoid cell phones up to your ear. Cell phones at a distance are much better. There's so many things you can do. And if you are a person who, one is if you're older, but if you have a family history of cancer, very important to take extra measures to make sure that you are not subjecting your body to the development of cancer. So I strongly urge you to take these ideas, start incorporating them one by one, and to really prevent cancer rather than treat it when it is full-blown or when you notice it. If you notice a breast lump, or you are having problems with chronic pain in the pancreas or the liver, or you're noticing some changes in the nervous system, these are all indications that you should be able to get an evaluation to diagnose if you are beginning cancer. There's a lot of tests now that you can catch cancer very early. And so to be able to diagnose these and to prevent them and to take things that are going to really help you fight off cancer, fight off other diseases as well, that's very important, rather than making sure that you can prevent them before they develop into major cancers. Prevention of cancer is so critical. It will, believe me, people who have financial problems and go into bankruptcy, many of them are with these major illnesses. And so I urge you, there are many reasons why you should avoid cancer. You should take all measures to prevent it and to live a good, healthy, long life. I hope this helps. And if you have any questions, please get in touch. Very happy to. And I will be back next week with another podcast on some very critical topics. Take care.